Hi, my name is Erica Casada York. I am a certified nurse midwife at Professional Gynecological Services here in Brooklyn, New York. We have been talking today about IUDs. This is one of 3 videos discussing what the different kinds of IUD are and how to go about getting an IUD, what it's like the day that you go into the GYN office to have your IUD inserted. That's actually the topic we're going to be discussing today, but please go ahead if you haven't already and watch the other videos to help you choose which kind of IUD you would like to have. All of the kinds of IUDs that are available in the United States are very similar to each other. They're all very small, plastic, T-shaped things about this big that are inserted through the vagina, through the opening of the cervix, into the uterus, through a little tube that is about as big in diameter as like an IV line tubing if you've ever had an IV. We do it just in the regular office. It's not a surgery. You do not have to be asleep or anything like that. It's a very, very quick procedure. Typically just takes a couple of minutes to do the actual insertion, several minutes to get set up for it, and you're typically ready to leave about 5 to 10 minutes afterward. To do the insertion itself, a lot of it is just very similar to other GYN visits that you've had. We have you on a regular exam table with your feet up so that your legs can be open. We're going to use sterile equipment for this because we want to decrease the chance that you will get an infection from any outside bacteria going up into the sterile environment of your uterus. I'm going to take a speculum, which is the little sort of duckbill shaped instrument that goes inside the vagina. This is going to be a sterile speculum. I'm going to clean the inside of your vagina with an antiseptic solution. Most often we use betadine, but if someone has an iodine allergy, then we'll use something different. So I'll clean the cervix. Typically we use an instrument just to hold the cervix steady, and then we will measure how deep your uterus is. This might be done either with an ultrasound, or this might be done by passing a very, very thin rod, again about the width of like an IV tubing, through the cervix all the way into the uterus. This feels kind of like a little cramp. Take that out. I see how deep your uterus is. I'm going to set up the IUD into its little straw-like inserter, and it just slides right in. At our office at Professional GYN, we always immediately afterward check the placement of the IUD with an ultrasound to make sure that it is in the correct place. It wasn't placed too shallow where it's going to come out. It wasn't placed too deep where it's going to cause a problem with the tissue of your uterus or get stuck in the tissue of your uterus. So we're doing this ultrasound immediately just to verify the placement. Some offices might not have that. Some offices may say come back after you have a period and we'll check the position. Some offices may only do an ultrasound if they suspect that there's a problem. There are lots of ways to do this. I'm just letting you know how we do it in our office. Typically speaking, the whole portion of the visit that is the actual insertion is going to take probably less than 2 minutes. I tell my patients to expect about 3 pretty strong cramps. For some people, these are simply uncomfortable. For some people, these are more painful. If you're someone that has an issue with pain, it might be a good idea to go ahead and take about 600 to 800 milligrams of ibuprofen about an hour or so before your appointment. That's between 3 and 4 regular strength tablets of ibuprofen. In some cases, we want to give some medication to help the cervix be a little bit softer. And so if you are going to a new office that you haven't been to before, you might want to ask and see if that's a good option for you. Typically, I'll know if it's one of my patients that I've seen before and I've examined before. I kind of know what your cervix is like. I know if it needs a little extra help or if it's already good on its own, but that is an option for some people. Once your IUD is in place, there are little strings that hang through the opening of the cervix, and the strings remain inside the vagina. They do not hang outside of the vagina like tampon strings. At the beginning, they feel kind of like fishing wire, but over time, they just get a little bit softer, and usually they kind of curl up and sort of stay kind of out of the way, tucked kind of behind the opening of the cervix. We use these strings later when it's time to take out the IUD, when either it has lived its useful life and is due to be removed, or when you're ready to remove the IUD, we use those strings to pull the IUD out. IUD removal is very simple, very straightforward, generally is not painful. Most people say that it just feels kind of weird. Again, we use sterile instruments. We clean the inside of the vagina before we remove the IUD, but it's much faster, much easier, and basically just slides right out. When you have your IUD inserted, we're going to tell you not to put anything at all inside your vagina for 48 hours. hours. This is to protect you from infection, but whether you have a copper IUD or a hormonal IUD, you are protected against pregnancy right away. Just please wait 48 hours before you have sex or put anything in your vagina for that matter. We will tell you to look out for warning signs such as any sign of infection like a fever or foul-smelling discharge from your vagina, if you're having abdominal pain, if you feel like something is inside your cervix or something is inside your vagina. We want you to come in so that we can examine you and make sure that everything is okay. It's very unusual for the body to push out or expel an IUD on its own spontaneously, but it does happen sometimes, so please definitely let us know if that's a concern for you. On the whole, most people who get an IUD are very happy with them. Not every birth control method is for every person, but if you're looking for something that is very, very, very effective, 99% effective, completely reversible, and that you don't have to remember to do anything with once you have it in, an IUD could be right for you. Please feel free to comment, send us any messages, schedule an appointment with me or any of my colleagues, or talk to your own GYN provider to see if an IUD is right for you. Also, if you haven't done so already, please watch my other IUD videos where I talk a little bit more in detail about the two kinds of IUDs, and let us know if there's anything we can do for you. Thank you!